Parliamentarians tried out a COVID-19 breathalyser test before entering the House today. Authorities are trialling the TracieX breathalyser. It was developed by a homegrown startup from Nanyang Technological University. Prime Minister Lee Hsien Loong says the process, which took 2 minutes, was fast, simple and non-invasive. Summing up the ministerial statements on how to live with COVID-19, Mr. Lee says Singaporeans will have to accept a certain level of fluidity. The Prime Minister reassured everyone that Singapore will get through this together. And for a closer look at Singapore's endemic plan, we're joined by Associate Professor Jeremy Lim from the NUS Swee Hock School of Public Health. Thanks for joining us this evening. Firstly, Singapore's reopening expected within weeks. It sounds like the endemic phase will start around then as well. What do you make of this timeline?
I think it is a very realistic timeline. Vaccination numbers across all the population groups have been very positive, but we certainly need to work harder for the most vulnerable group, which would be the seniors. But I think that we are on track, unless something disastrous happens, like the emergence of new and even more devastating variants.
In terms of what might disrupt the plan, Professor Lim, I mean, you've just mentioned there the fact that if another variant were perhaps to emerge, that might be, it might put, the time frame for going endemic, having this endemic plan into some jeopardy. But do you anticipate that?
Well, it is very unlikely. So far, we've been very fortunate. The world has seen the emergence of the Delta variant and so far nothing, but we should expect further variants, but it's doubtful that any will be so really transmissible. And I think that, fingers crossed, we are in a good place presently.
We also got a glimpse, if you like, or a hint of how the differentiated approach for the vaccinated and unvaccinated could play out. How would you gauge acceptance of such a plan, especially among those who can't get jabbed for medical reasons?
Well, I think those who are fully vaccinated will certainly be very, very pleased with the announcements made today. Those who have not been vaccinated or are unable to be vaccinated, understandably, will be very disappointed. But as Minister Ong had really articulated, it is, from a public health point of view, necessary. Those who are unvaccinated are at higher risk both of transmitting COVID-19 and also of developing severe disease. So it is unpleasant, but it's necessary.
Professor Lim, vaccination of seniors is picking up, but it's still not at the stage where we might consider it to be ideal. So what's the argument for and perhaps against making it mandatory, especially for this group?
Well, I would not advise that the vaccines be mandated. And I think that, as Minister Ong had mentioned earlier, it's still under emergency use, and until it's fully authorized, we should not think about such as harsh or such strident decisions. But that said, clearly from a public health point of view, we do need to differentiate just simply based on risk. Those who are vaccinated against those who haven't been vaccinated. And I do suspect that in the Singapore setting, as we're seeing in France as well as in Israel, that the differentiated approach and what those who are unvaccinated cannot do will be sufficient to tip the balance. And I think in the days and weeks ahead, many of those who have been sitting on the fence will step forward to be vaccinated.
All right. Many thanks, Professor Lim. Thank you very much. We've been speaking there to Associate Professor Jeremy Lim from the NUS Swee Hock School of Public Health.